Warning, don't call an implant dentist until you hear this free message.
Hey, Dr. Tyler Williams at Pinecrest Dental. I want to share with you an important message about 4 common ripoffs that we often see people run into. So you want to take care and pay attention to these 4 things before you call an implant dentist. The first one is avoid a one-size-fits-all solution. So if you're only offered one choice, one option, like take all your teeth out and have screw-in implants as your only option, then that could be a dead end for you. Most people, we find, need to have 2 options, maybe 3. And you could still replace all of your teeth, but even by replacing all of your teeth, there are 2 or 3 options going that direction. So if you're feeling like a one-size-fits-all solution, then be careful, because you may end up with something that you spend a lot of money on and you're not very happy with. The second one is avoid feeling rushed into treatment. So if you feel like you're pushed into quick treatment to get it done as fast as possible, then could be a dead end for you. Now, we all want a new smile done as quick as possible, reasonably possible. But if it's rushed, or it's done really quick, or there's not good communication about what's happening next, and you don't have a timeline mapping out all of your next visits, then proceed with caution. We've seen some horrendous disaster cases from patients who receive this kind of treatment both inside the US and outside the US. And it's very sad when you see someone in tears because they regret the poor choice that they made on treatment. The third one to avoid is insurance talk. Now, you probably want to work with an office that's insurance friendly, but if it's solely based on what your insurance covers, you're going to be very restricted on the outcome and the options. A lot of times, what's a better option is to look at a membership plan or a payment plan where you can work directly with the office and not let the middleman tell you what you should do or you shouldn't do, because it's your smile and your life, and you only get one smile, and this is your time to transform, get the smile you've always been looking for. So make sure the office has some other options for you to discuss as far as financing or payments or prepayment, those kind of things, right? So those are 3 out of the 4 that you should look out for. And then the fourth one would be watch out for teeth that look too bulky or unnatural, or they look like chiclet teeth. You want to make sure that the office understands not only the science and the medicine behind implants, but also the art of how a smile is going to look. And you want to be able to see some before and after pictures, or some videos, or some brochures that show actual patients from the office who have gone through same or similar treatment. So you know that this has been done before, but also those people are still smiling, and that you'll have a smile for years to come. We work on cases all the time where patients had teeth put in that were too wide for their facial profile, or too long or too short. And so there's some specialized knowledge of how to make sure that your teeth shape and size match your facial profile shape and size, because the teeth you have should not look the same and will not look the same as your partner or friend or spouse, because each of us have different size bodies, different size faces, different size heads, different lip position, and all these things need to be accounted for. So those are 4 things that when you're vetting out an implant dentist, or when you call the office, you want to ask about some of those things to make sure that you are on the right track. So we wish you nothing but success in your journey, and we're happy to share this information with you so that you can avoid problems, disaster, or regret. So thanks for watching, and have a wonderful day.